My name is Kay Tillow. I'm from Louisville, Kentucky, and I'm the coordinator of the All Unions Committee for Single Payer Healthcare, HR 676. And we set about some time ago to reach the grassroots of the union movement, believing that our union movement is a crucial piece of the social justice movement within the country, and it's a necessary piece of how we move the nation forward. And if we can move that movement to take the lead in this campaign, it's a vital part of the constituency that will make it happen. And we believe that the words single payer are not foreign to people, that people can understand that there would be a good response to the idea of removing the private profit-making insurance industry from the system and to going to single-payer health care and to HR 676, and that people understand legislation and that they can get on board with it, and it's spelled out in a way that people can take action. And we've been overwhelmed by the response. At this point, there are 452 union organizations that have endorsed HR 676. They include many of the building trades unions. They include the United Association of Plumbers and Pipe Fitters. They include the United Transportation Union, the railroad workers. They include 111 central labor councils, which is a huge number, and those are all across the country, and they are not just in the areas that we think of as being more liberal. They are in Cape Girardeau, Missouri, the hometown of Rush Limbaugh. They are in Paducah, Kentucky, my hometown. They are throughout the heartland in the areas across the country where people are feeling the incredible suffering of the people and looking for bold answers. The bolder the better for many people. And so we did not know that this would happen, but the movement began to blossom at the level of the state AFL-CIOs. That was a little amazing. You know, that's the highest body of all of the unions within a state. And one after another, first one in Kentucky, of course, came out for HR 676. But after that, others, because they're looking for the kind of things that really offer a solution. You know, people are so tired of something that moves us an inch ahead and we lose the inch the next time around. We need a bold and brave solution that will inspire the nation. And so we believe that it would be important for everybody to work with the unions in your area. If you don't know who they are, I'd be glad to talk with you. If you want to get on my list, you're welcome. You can work with the ones who've endorsed, to team up to go get the Congress people on board. That would be a good basis for building the movement within congressional districts. And you can work to go after the ones who have not, because everything that we do builds and builds and builds. And I think that, you know, what we found is that we can't be too bold on it. We haven't been able to find a project that we can't do. I mean, people said, well, we're going to try to get the endorsement of the Presbyterian Church. I said, oh, that's not easy. And a few activists took the initiative, and they did it between the Pittsburgh people and the Louisville people. They just won it at the General Assembly in San Diego. Wow. That statement says the single-payer health care is the best embodiment of the spirit of the gospel. Wow. You know, amen. And you know, then there were a small group of people in Florida took up the issue. Well, the woman called me, said, you know, we'd like to present this at the U.S. Conference of Mayors. It's all the mayors of the cities over 30,000. I said, oh, that's a good idea. You know, but I don't discourage people. They did it. Wow. They got the mayor of Palm Beach. They got, I think, 6 or 7 mayors. The mayor of Palm Beach, the mayor of Santa Cruz. I can't even remember who the others were. Baltimore's mayor. There were about 7 of them, did a letter, they put it out to all of the mayors, they put it on the agenda, they testified on the agenda, and they unanimously passed support for H.R. 676 at the U.S. Conference of Mayors in June.
Wow.
So I would just, I applaud your work. I would take every initiative you can. I think healthcare could be the touchstone for many other changes because it's so close to people's hearts. You know, in Kentucky, we just got the figures. 40% of the insured go without care. The insured go without care because they can't afford it. I mean, we are now all in the same boat. Those who have no coverage, those who have covered, those who are poorly covered, those who are at risk of losing their coverage. It really is our time to move this movement forward. Thank you.